Good morning, everyone. My name is Alfonso Ielasi, and I'm an interventional cardiologist at Galeazzi Sant'Ambrogio Hospital in Milan, Italy. Diffuse coronary artery disease is a very challenging scenario in interventional cardiologists. Stent length is well known to be an independent predictor of events at midterm and late follow-up in terms of restenosis and stent thrombosis. So for this reason, it would be very welcome for us interventional cardiologists to find some strategies in order to limit the total amount of stent length. In this scenario, the use of a hybrid strategy mixing the implantation of a drug-eluting stent and the inflation of a drug-coated balloon could be a very interesting approach. So the HYPER study is a prospective, single-arm, multi-center Italian study with the aim to assess the clinical results following a hybrid strategy for the treatment of diffuse coronary artery disease. When I talk about diffuse coronary artery disease, I mean true bifurcation and or long lesions with a length more than 28 millimeter. So there is not a universal definition for hybrid approach. In this study, hybrid approach was defined as overlapping or slightly superimposing of 2-3 millimeter in length DES implanted in the larger, more proximal segment of the lesion or at the main branch of a bifurcation, with DCB inflated in the smaller, more distal segment of a long lesion or at the side branch of a bifurcation. So the study was completed at the end of 2020, and 1 year results were presented last year at Euro pre-PCR. Primary endpoint was a clinical and combined endpoint, device-oriented composite endpoint, including cardiac death, target vessel MI, and ischemia-driven TLR. Results at 1 year were very encouraging. DoCE rate was 3.7%, mainly driven by ischemic-driven TLR, 3 events in the DCB segment, while 1 event in the DES segment. Most of these events were related to the treatment of long lesions, and all the events were successfully treated with PCI. Talking about the angiographic results, which were assessed by an independent QCA core lab, the benefit of this strategy was evident in terms of increase in the minimal lumen diameter and in percentage diameter stenosis in both DES and DCB target segment. The DCB used for the study was the RESTORE paclitaxel eluting balloon, which is a new generation device which has an amorphous coating made of shellac ammonium salt, which is hydrophobic during tracking and lipophilic during inflation. It means that wash-off of microparticles should be minimized compared to other DCB actually available on the market. DS used were of different brands according to operators' discretion. So moving from the 1 year data to the 2 year follow-up, we have seen no events in terms of ischemia-driven TLR or thrombotic events at the DES or DCB target segments. Only 1 cardiac death was reported, a sudden death, so the total amount of DoCE at 2 years follow-up was 4.6%. So I would say very encouraging. Even 31 patients underwent angiographic follow-up at a median period of 4 to 6 months, and the late lumen loss reported was of 0.12 plus minus 0.15 in the DS treated segment and 0.15 plus minus 0.2 in the DCB target segment, so results which are in line with other DCB actually available. So in conclusion, I would say that the HYPER-EXTEND study reported a very interesting result in terms of device-oriented composite endpoint Of course, this is a pilot study with small samples, and randomized controls trials with head-to-head comparison versus a full metal jacket PCI procedures are needed to better understand the role of this hybrid strategy for the treatment of diffuse coronary artery disease.